And welcome back. I'm Mabel, Jong. You're watching continuing coverage of the World Healthcare Congress here from Washington, D.C. Thanks so much for joining us. And in our studio right now, we have Chad Gray, who's going to talk a little bit about his company, Integrated Mechanical Care, and also some of the issues facing the healthcare industry today. Thank you so much for joining us, Chad.
My pleasure, Mabel.
Well, tell me a little bit about Integrated Mechanical Care and what you're focused on in your business.
Focus on trying to improve the outcomes and certainly the cost of care for the musculoskeletal domain of healthcare. It's typically the #1 plan spend year over year for most health plans inside these self-insured organizations, and so it's gotten a lot of attention recently because of that. We've been focused in that area for about 25 years and trying to kind of refine the protocols that are used inside of primary care practices and inside of conservative care practices such as PT and chiro practices or disciplines, and kind of optimizing their training and their capability to effectively triage these cases and move them into the right kind of pathway or treatment model or method.
Why is there so much focus on that particular area right now?
Well, it's a very frequent event inside of a population. It's typically the highest frequency event that will occur inside of a health plan. About 30% of any given population in any plan year is going to enter the system for a musculoskeletal condition. And as a result of that level of activity, you have a fairly high cost profile. So anywhere between 17 and 22% of your entire plan spend is going to be in this area of healthcare. And so as a result, it has received a bunch of attention from employers and purchasers or payers.
And in your work, have you been able to identify any place where money can be saved in addressing this problem?
Yeah,
this particular area?
Yeah, the first stopping point, I think, the first really point of influence that's significant is in primary care, because about 60% of all the cases are going to enter through that gateway there. And the med schools in the U.S. don't have a lot of training and education in their curriculums around this particular condition category. So that's the first opportunity to really increase value in this area, is in taking the gaps, the critical gaps that exist in primary care training, and instituting some protocols and some training that gets dropped into that platform that then allows them to do a more effective job of triaging these cases and either moving them into self-care protocols that they can administer right there in the practice and kind of keep people in the house, or do they escalate it out into a conservative care program using physical therapy or chiropractic care, or is it truly a structural defect that needs to be escalated into a surgical encounter? We try to teach the primary care providers in these relationships they have in on-site, near-site, direct primary care clinics, or even community clinics with health systems. We try to teach them how to do a better job of making that classification or subgrouping as they triage patients and move them towards the most appropriate care at the right time.
And are you finding that providers are, and all the stakeholders that work with you, are buying into this new way or a different way of doing things?
Yeah, I think primary care certainly has been frustrated in this area for a long time. I mean, if you ask most primary care providers, do they like managing back pain or knee pain or hip and shoulder pain, they'll clearly tell you across the board, no, we don't like to see it at all, because they just weren't taught how to manage effectively in that space. So they welcome new tools and new capabilities to kind of optimize their ability to produce outcomes in this area. So we've seen a pretty good adoption rate from primary care in taking on the training and the protocols and improving patient outcomes for the folks that they care most about, their panel of patients.
Does your company deal mostly with Floridians, people in your state?
No. We partner with self-insured employers that can be regional or local or national. And so we have a national network of facility-based clinics that can be used as access points for employers if they want to create steerage into that platform. We have a virtual care platform that will cover 49 states and will allow us to reach out and touch lives that may be remote in rural areas or distributed across the country, or that may not be near a brick and mortar operation where we can steer them into that. So we've got those two options that allow us to have kind of a national footprint and reach out and help these multi-site and more national, large to jumbo accounts really find access to high-level, high-value care.
So are you seeing some states more quickly adopting new ways of doing things in other states, or across the board they all sort of have their own?
It's just, wherever an employer calls us to go, we typically wind up there. We don't see much variation in adoption or agreement with these strategies by region or by state. It's just really more or less which employers are kind of sitting at the point where they're ready to make that leap and do something fundamentally different and directly contract with an organization that can create a really high-performing kind of narrow network for them that has better capability than the rest of the system has today.
Okay.
Yeah.
Okay. What encouraging trends have you seen in your work?
The most encouraging trend, I think, is the fact that the C-suite and a lot of the HR teams inside of these self-insured organizations are fed up. They're ready to be brave, to get courageous, to start to push into an area of industry that they haven't always been comfortable engaging in. Healthcare was kind of a scary thing, I think, maybe 20 years ago, even 10 years ago, perhaps. But I think once the magnitude of the problem reached the level that it did, they started looking for solutions and looking for answers, and they began to push into the market and really seek out what was broken, what wasn't working, what was working, and then start trying to find ways to bring those solutions into their populations. So a lot of courageousness and a lot of kind of enthusiasm about getting out there and fixing the healthcare system, and quite frankly, I think employers really have the greatest opportunity to pull that off. I don't think we can do it without them.
Okay. And how are you finding the conference so far?
I'm loving it. Yes, it's probably been the best one, and I've been coming here for 4 years, I believe. I think this has been the most enlightening one so far, so loving it.
All right. Chad Gray, thank you so much for your time today.
Thank you, Mabel.
Really appreciate it.
Pleasure.
And thank you for tuning in. Stay with us. We have much more to come.